More than just a diet gone bad, eating disorders have the highest mortality rate of any mental illness. Learn how recovery from an eating disorder is possible with the right help, next on Speak Your Mind. Welcome to Speak Your Mind. I'm Dr. Carolyn Phelps, licensed psychologist with the Human Development Center. If you've heard that recovery from an eating disorder like anorexia nervosa or bulimia nervosa isn't possible, you heard wrong. Recovery is possible, and there's reason to have hope, especially if you get the right help. Tonight, we're talking about taking your life back from an eating disorder. You can be a part of this discussion, as always, by calling the numbers on your screen right now locally. Dial 218-788-2844 or call toll-free at 1-877-307-8762. We'll be answering your questions throughout tonight's show. Joining me tonight is Dr. Andrea Zulig, a licensed psychologist who specialized in treating people with eating disorders for more than 12 years. She presently works at Park Nicollet Melrose Center, a specialized full-service eating disorder treatment program in the Twin Cities. Thanks so much for coming up on this beautiful kind of fall day. You must have had a nice ride coming up.
Oh, it was beautiful.
And we did that just for you.
Oh, thank you.
Yeah, just to make sure that you would get here safely. Now, I mentioned in the intro that there are a lot of people out there that there's sort of this myth that it's not possible to recover from an eating disorder. Once you have an eating disorder, you always have an eating disorder. And tell me what your thoughts are about where that comes from.
Absolutely. I think that that's really tragic, actually, because one of the dangers of that is that I think that really keeps people from getting the help that they need. And what we know is that full recovery from an eating disorder is absolutely possible. My experience is that I think that people relate eating disorders to substance abuse and think once you have it, you've always had it, and there's no help for getting over it.
And I like what you said, that myth potentially creates a barrier for people getting help, or at least getting help earlier. And we always know that the earlier that you get help, the easier that treatment is going to be.
Absolutely. The earlier the better for full recovery.
Let's talk about and one of the things that I think that where maybe treatment for an eating disorder can be a little different than treatment for depression or anxiety is that we generally think of this as this is an area requiring specialized care, and that you don't necessarily want to see a generalist for treatment of an eating disorder. Speak a little bit to that.
That's really true. I know that where I work at the Melrose Center, we have a physician that is specifically trained in the treatment of people with eating disorders. Patients always see that physician. They always see a licensed dietitian who knows specifically about treating patients with eating disorders, a psychologist or therapist that is involved with that treatment. I would be very concerned if I was just, even as a specialist, if I was just treating a person myself, because you really do need the full team. This is a very complicated disorder.
And so you bring up a very great issue, which is that it needs to be, you have a treatment team. When you are getting help for treatment of an eating disorder, you're not just seeing a psychologist or a psychiatrist. You have a team of professionals, and there's different components of that team. So let's talk, you mentioned each of those components. Let's talk a little bit more about why they're important. So medical care, and medical care from somebody who knows a little something about eating disorders. Tell us why the medical care component is so important.
The rate of mortality is so high for people with eating disorders, and they need to be screened so carefully for slow heart rate, changes in blood pressure, other physiological changes, chemical changes, electrolyte changes, all of those things. And it's very interesting. I don't think, unfortunately, that a lot of physicians have really received that specialized training. And so, unfortunately, a lot of people slip by.
And they don't know what the gold standard of care is within what the gold standard of medical care is for somebody, if you're treating somebody with anorexia or somebody with bulimia. Then.
Absolutely. And for example, one thing that we've seen sometimes is that it's very common for people who have low heart rate to also be considered physically fit. However, if that person also has an eating disorder and they have low heart rate, what that means is that their heart muscle is very weak. And so a physician that is specifically trained in the treatment of eating disorders would be able to pick that up and think, wow, this person needs inpatient care.
That low heart rate, in this particular case, is not a sign of improved health, right, but a sign of decompensated health.
Absolutely.
Nutritional care. There used to be this slogan, and one of the eating disorder awareness, nationally ranked eating disorder awareness group was running a slogan. It's not what you're eating, it's what's eating you. And I thought that was catchy, but misleading, because when it comes down to brass tacks, 50% of it is what you're eating or not eating, as the case may be. So talk about the importance of specialized nutritional care, and just even like why nutritional care is so important in the treatment of people with eating disorders.
Absolutely. One of the things that we see with eating disorders is that when people are not eating regularly, the effects of malnutrition are pretty serious, both psychological, cognitive, in the body, everything. And it would be great if I could sit around and talk with people and they could get wonderful insight about why they're not doing this. But if they're not eating, or they're not eating regularly, or keeping the food in their bodies, there's really not going to be any lasting change. And so absolutely, we do need to see people eating regularly, getting variety of food, getting their weight up to a reasonable weight goal.
And so we know that the undernourished brain is a distorted brain as well, right? That it really, that starvation effect on the brain affects, can affect your mood, affects how sensitive you are to other people, but also affects your perception of your reality versus everybody else's reality. And I say a lot to not just the people who I'm seeing in treatment, but often to family members that, right now it's kind of like dealing with somebody who's drunk.
Yeah, absolutely.
Because of the level of the level of distortion. And so if we don't get that, undernourishment taken care of, then we don't really have a chance to work on the other issues as well. That's part of how I've certainly seen that.
Yes, we see that too.
And then psychological care. So I know that there are a lot of people with eating disorders who will say, like, well, I'm willing to go see a dietitian, but I'm not going to see a therapist. And what would you say to that person?
Oh, please see a therapist. I think therapists are such an integral part of the picture, because it's one thing to work on the food part. We just talked about how important it is, of course, for people to really eat regularly and get that nutrition, but people also really need to learn new coping mechanisms. They need to figure out what it was that led them to use food or the lack of food as a coping mechanism in the first place. And if they don't realize that, they are going to keep getting stuck in the same old patterns.
And it's not just a calorie disorder or a weight disorder, it really is a psychological disorder. And so why would we be skipping the whole psychological care part if it's a psychological disorder?
Yes.
Then,
yes.
Right? So I think pretty much you should figure this out now. What Andrea and I have been telling you is that specialized care is really important. And part of how I think I see that too is that people who don't specialize don't know what they don't know.
Yes.
And so they won't ask the right questions to get the information, and that's how they're sort of skipping these big pools of information that's going to be helpful to the person in their treatment. Let's talk a little bit about what the sort of common themes are. So we talked about psychological care is important. What are the common themes that need to be addressed for individuals who have eating disorders in terms of their psychological care, things that we see commonly?
I think that a big part of things that we see really are the difficulties with emotion regulation. So this does not pertain to everybody, but it does seem like a large group of the patients that I see tend to have difficulties identifying emotions, tolerating emotions, regulating emotions, and coping with their emotions in some way other than numbing it out through restriction or basically through binging and purging. I would say that really another one is for a subgroup of patients, they may have underlying trauma. And of course, that's going to be very important to deal with and look at that and examine that.
So we certainly see, and part of this is that people with eating disorders can have other psychological problems too, that there's a high, in the business what we call it is a high comorbidity, which means if you have an eating disorder, there's a pretty high likelihood that you could have either a trauma-related disorder, depression, anxiety, or a substance use disorder. And so we know that psychological care better be handling not just the eating disorder part, but if there are any of these other psychological problems, that everything needs to be treated then.
The whole package.
Let's talk about perfectionism. We see that as a common theme, sort of across eating disorders, certainly within anorexia and bulimia, that people who develop eating disorders tend to be a tad on the perfectionistic side.
Just a little bit.
Just a little bit. And so what are some strategies that you use to help people sort of move away from that?
Well, it's so interesting because I think that these perfectionistic people are so much fun to treat because they also tend to want to be perfectionistic in their own treatment. And so sometimes it's the idea about being able to really look at those cognitions and challenge them to not be so black and white, all or nothing, to allow themselves to start to make some mistakes and to tolerate that in themselves.
Here's a question from a woman of what are the first signs of an eating disorder, and how might you know when you need to get help?
Oh, that's a good question. I think that one of the things is always changes in weight, changes in appearance. However, you always have to be careful about that because not everybody that has a change in their appearance has an eating disorder. We see personality changes, we see lots of talk about food, avoiding food, eating too much, eating too little, just any types of major changes, particularly that have to do around eating, exercise, use of the bathroom after meals, and really personality.
I think that one of the things that I see too, that even people who don't want to be in treatment, but maybe they're coming under duress because other people in their life want to come. The one thing that they would agree with is I spend way too much time thinking about food, weight, and my appearance. Like my brain drives me nuts about that. And if there was one thing that they could treat, they would want that thing to go away. They don't want to change how they're eating or gain weight if they need to gain weight, but they would want to change that. And I think that might be a good way for if there are people in the viewing audience, if you feel like more and more of your time that you think that deciding what you're going to have for lunch is the same kind of decision making that goes into negotiating peace in the Middle East, like that's wrong. And there's a problem there, right? Too much time spent on that.
Yes, definitely.
So we were talking about perfectionism, and you said one of the things that you said is that, we kind of make perfectionism work for us in the beginning because people will do their therapy homework. And then what we want to do is sort of kind of move them a little bit away from that. I see really this, that whole sense of self-esteem of the only way I can tolerate myself is if I'm perfect. And I can't embrace my failures and don't see them as a thing to learn from, but see them as a thing to be ashamed about.
Yes, we see that as well.
And so how would you help somebody, what's a strategy that you might use to sort of help somebody kind of move away from that perfectionism and to that, like, it's okay to make mistakes, it's okay to be imperfect?
I think that one thing that I often encourage is actually playfulness. Because that's one thing that I think sometimes is missing in this population, particularly with perfectionistic people, is that they're not playful. And when people are playful, they don't have a lot of time to think about being perfect. And so when they're able to be playful, to embrace that, to think about what their passion is, really what their goals are, but to not be so black and white about it and rigid about it, but to start to embrace and experiment a little bit with that. And that's a tough sell.
The control is another issue that we see. What I see is that people who develop eating disorders tend to be high need for control folks.
Yes.
That they like that, down to, how your clothes are ordered in your closet, to things that are, a little bit more consequential in life than the ordering of clothes. And so tell me what your experience is about getting people to move from being such a high need for control and really moving towards that acceptance that we are not in control of the universe the way we sometimes think we are.
Yes, and you mentioned acceptance, which I think is so great. A strategy that we often use is a dialectical behavior strategy called radical acceptance, and being able to radically accept exactly that things are not the way that we would necessarily like them to be all the time. It's interesting because with that rigidity and that control, I do think that some of that does decrease when people start to restore weight and become less malnourished. But so much of this, I think, is really challenging those deep thoughts and those cognitions and exposing them to some extent, either through challenging their thoughts or their behaviors, and trying to do things a different way and seeing how that is.
Well, I really like what you just said, which is that that one of the things that a team approach uses too, without maybe even explicitly doing that, is using that where we're trying to get you to be flexible with your eating, we are now going to widen that funnel and get you to be flexible in other areas of your life as well.
Yes.
Right? That like you get your first practice right here with the eating, but now we're going to expand that to other areas of your life.
Yes, like what would it be like if you took this different job or took some risks with school or family, or really widening their life so that's not this narrow little box based on weight, shape, and appearance anymore.
There's a question here about how do you prevent eating disorders given sort of the socio-cultural dictate in this country around beauty and all of the ads and the celebrity culture. And I think a different way of posing this question for tonight's discussion is, how do we help people even who have eating disorders develop some calluses around the socio-cultural norm for our country?
And being able to really develop a thicker skin. There's a movement out there that I think is wonderful that talks a lot about educating our kids, particularly our girls, but we're seeing it also in our boys, about media, about just the amount of changes that are done with pictures and photoshopping and all of that, and trying to really base your worth on something else other than shape. Some of the myths that happen about that if you are thin, then you are more worthy or somehow or more attractive or more appealing, and that if you are overweight, then you must be lazy or something like that. And really, really starting to challenge those and helping kids to start to do that too. They can develop some immunity for themselves.
I always like to talk with my clients as well about this concept of, if you don't have that version of beauty, what will you lose in your life? What is it that you want to do with your life that requires that level of beauty, or that requires you to look a certain way or to weigh a certain amount? And often they're kind of stumped by that question, because they haven't thought about it. All I know is that this is how I want to look, and that's going to get me all of this stuff. And it's like, except that's not always true. And I think that it's true for some professions. If we're a model, true. And if you want to be a model, and you want to risk having a mental illness on top of it, then I mean, I think that's kind of one of the things we need to take a look at as well, right?
Yeah. It doesn't sound like a very good choice to me, but you know.
Right. The self-esteem issues. One of the things that you mentioned is developing a sense of self-esteem that is not about body appearance.
Yes.
And so, what are some strategies that you use with people in terms of getting outside just being focused on body, around like how you determine if you feel good about yourself?
Mm-hmm. Well, and I think that one thing that we used to do in this field is that we used to talk about body image, and I think that we're finding now that that isn't very helpful because it just makes people spend more. So I know that some of the work that I do is I try to focus people more on their values, on what they feel passionate about, what they love, what makes them excited, and what stops them from doing those things right now, despite body image difficulties or how they feel about themselves or their fears, and just going and doing it, taking small steps in those directions.
In fact, in my own practice, body image issues are the absolute last thing that I deal with, because we see a lot of it drops out. If you can normalize eating, normalize weight, people start getting interested in the rest of their life. They start doing the rest of their life, and all of a sudden they look back and they say, like, I don't even recognize that person who I used to be.
Yes. Yes, and I think that people get that mixed up sometimes, because I get people in my office all the time that says, okay, you know, let's work on these body image issues and then I'll eat. But really, it really needs to be the reverse, because if they're not eating, if they're not getting up to a reasonable weight, if they're not nourished, you can't do anything with those negative body image thoughts.
Let's talk about the role of families and friends. First, with adults who have eating disorders, and the role of family and friends with adults who have eating disorders.
I think that they're so essential, and that's interesting that you brought up adults, because we usually think that just with kids, but even with adults, we often say that you cannot cure an eating disorder as an island. You know, nobody can do this themselves. They need a full treatment team, and they need the help of family, friends, any support that you can get, people that are going to be there, care about you, eat meals with you, distract you afterwards. That's all very important.
And I think part of that too is having the family have some education about what is helpful and what isn't helpful, since often at the point where we see people coming in for treatment, family relationships may be pretty strained at that point in time, because you have families who have been so concerned watching somebody deteriorate often in front of them, or dealing with a person who hasn't been willing maybe to get help in the beginning, and that straining relationships, that just has some education around what's helpful and what's not helpful, and for the client to be able to have some input about, like, this is a helpful thing for me, this is not helpful. And also just giving family feedback, like constantly reassuring the person they're not getting fat really isn't a helpful thing.
Yes.
That kind of reassurance seeking we see with phobics, and we know that reassurance, because it never works, right? It never works.
Just makes it worse.
Family support with kids who have eating disorders.
So there's a very common method that used to be called the Maudsley method, and now it's called basically family-based therapy. And basically what this is, I know you're familiar with this, is that, you know, the parents, we basically have the parents be the coaches, where they refeed their children, and they sit down with their children and they eat with their children, and they provide a lot of encouragement and guidance and support, and sometimes some pretty tough limits. But that really has been found to be extremely effective, because you're mimicking the inpatient setting at home, which basically all the work is going to really need to be at home anyway.
The inpatient setting is not life. That eventually, you don't stay, if you do get to an inpatient level of care, you don't stay there forever. You have to go back and figure out life in your home, in your home environment. We are coming to a close. What would you say, so to people out there, what would you say are sort of the last words of hope with respect to getting help for an eating disorder?
Well, I think just to remember that there is hope, and that people get better all the time, and that's so important to get in early, even if you haven't gotten in early, just to get that help and to know that they are not alone, and that it works.
Treatment absolutely does work. And so if it's been a while, if you've had an eating disorder for a long time and you weren't one of those people who got in early, there's hope for you too. I have never ever seen a person who's recovered from an eating disorder who subsequently said to me, gee, I wish I hadn't done this. So it is life-changing, and it can be life-changing for you as well. Thanks so much for joining the discussion this week. And don't forget to visit us on the web at speakyourmindonline.org, where you can find a schedule of our topics and resource links. Next week, we will be talking about restorative justice and finding inner peace by restoring justice. I'm Dr. Carolyn Phelps. Thanks for watching, and good night.